We're going to talk about diet and health, or more specifically, diet and disease. There was a study published in the Archives of Internal Medicine in 2009 that showed that 4 lifestyle factors prevented disease. Before I make the list, why don't you think about it for a minute and think if you can guess what one of those 4 might be. And maybe I will tell you the benefits first. Those who followed all 4 lifestyle factors had an 80% lower risk of developing chronic disease. So let me read that again. Those who followed all 4 lifestyle factors had an 80% lower risk of developing chronic disease. That was a 93% lower risk of diabetes, 81% lower risk of heart attack, 50% lower risk of stroke, and 36% lower risk of cancer. So just think about that for a minute. Think about the power of that statement. Think about if someone told you they could tell you how to reduce your risk of having a heart attack by 80%. That's pretty powerful. That's a pretty amazing reduction in risk for what is one of the leading causes of death in the United States. Okay, so back to our list. What do you think is on the list? Number 1 was never smoking. You probably could have guessed that one. Number 2 was having a BMI, body mass index, less than 30. So staying at a healthy body weight or mostly healthy body weight. 3.5 hours a week of physical activity. And because you're in a nutrition class, what do you think the last one is? Following a healthy diet. So on the one hand, it's nothing novel, it's nothing new, it's not anything you haven't heard before, which I think is why some people downplay the importance. But taking care of your body by not letting it smoke, not letting it get overweight, moving it, and putting healthy fuel in it, you can reduce your risk of chronic disease by 80%, including the big 4, diabetes, heart attack, stroke, and cancer. So let's talk about heart disease. Several of the leading causes of death in the United States are diet-related. Heart disease, I would say, would be the most important to talk about because it is the leading cause of death in the United States and it can be made better with lifestyle choices. So essentially what's happening with heart disease or atherosclerosis, hardening of the arteries, lots of different terms for it. Let's see if I can draw this for you. If we have a cross-section of an artery here, most definitely not drawn to scale, but just big enough so you can see it. If we have a healthy artery, all that area in the interior is empty and the blood can flow through. If we have a diseased artery, we have an accumulation of plaque inside the artery, and depending on how much plaque we have, or how much plaque we have determines the severity of our atherosclerosis. So if you've ever heard a doctor discuss someone's arteries and say that they were 40% occluded, 80% occluded, basically they're making a judgment by looking at a cross section here of estimating how much of the original area that the blood could flow through is now plugged or coated with plaque. So this by itself is not necessarily painful. It doesn't necessarily cause symptoms. Sometimes it does. Sometimes it causes what we call angina or chest pain. Sometimes it causes shortness of breath because there's a reduction in blood flow, which means a reduction in oxygen delivery. But many, many people have this and don't know they have it, which is why it's sometimes called the silent killer. The problem generally happens with blood clots. So let's see, what color should we make our blood clot? If a blood clot were to come through this nice clean artery, in theory, no big deal. You've got enough room there, the blood clot can come through, no problem. However, if we have a blood clot in this artery, and it just happens to be big enough, and the artery just happens to be occluded enough with plaque, what will happen is we will stop the blood flow, and the blood can no longer flow through that artery. If that happens in an artery on the heart, one of the coronary arteries, the person's just had a myocardial infarction, which is the official medical term for a heart attack. Similarly, a similar process can happen in the arteries leading to the brain, and in that case it would be one type of stroke if the blood flow was stopped to the brain. So this right here that you're looking at is the leading cause of death in the United States. This is what is killing more moms and dads and grandmas and grandpas and uncles and aunts and sons and daughters than anything else in the United States. It is so interesting because they think possibly a similar mechanism is happening in other blood vessels in the body that might be causing some of our other medical problems. They think perhaps maybe some chronic back pain might be tied to plaque accumulation in arteries that are serving the back. They think other parts of the body might be having difficulties because of reduced blood flow. It's so prevalent, and yet we know it's something that can be made better with different diet choices and with exercise and potentially with reducing smoking or eliminating smoking and reducing body size. So let's talk about some of the treatments. Do you know any of the current medical treatments that we use to treat atherosclerosis? Oops, let me change my pen here. Angioplasty is generally the first step. And in angioplasty, they take a small, let's see if I can draw a side view here for you. In angioplasty, we've got our artery. We've got some crud along the sides. And the way that they treat it with angioplasty is they put a small balloon on the end of a wire and they feed the wire up into the diseased artery. And here's your little balloon. And when they feed it through the body, they actually start in the groin area in the leg, and they can take a fairly direct route from there, watching on x-ray, up to the diseased artery. They put the balloon into the diseased artery as it's deflated, and then they inflate it, and it kind of smushes the plaque up against the sides of the arteries and maybe gets out any air bubbles and widens that area a little bit that the blood can flow through. The second option that is sometimes done with with angioplasty or after angioplasty is stent placement. So the stent procedure is very similar. They take the wire up through to the diseased artery with the balloon, but around the balloon is what they call a stent, which is a little wire. It almost looks like a spring from a ballpoint pen, if you know what those look like. And they thread it up into the artery, and they place it in the area where the plaque is, and then they deflate the balloon and pull it out. The stent serves two functions. First, it's a little bit of structure, a little bit of scaffolding there to keep the artery from collapsing in on itself because of the plaque. But some of the newer stents are actually called drug-eluting stents, and they slowly, over months and years, drip out anti-clotting medication to minimize the risk of clots in that area where the artery is narrowed. And the last medical treatment that we have is a coronary artery bypass graft, lovingly called in the hospital a cabbage, because it's a lot easier to say. And I bet you guys have heard of these before. With a cabbage, if we have, let's see here, if we have our heart, not drawn well, obviously, and let's say we have an artery that's traveling here, and it's become pretty plugged with plaque, they will do simply what the name implies. They will bypass that clogged artery with a graft. So they will take an artery from another part of the body, and they will simply bypass the diseased artery with the new artery. So let's see here. So they'll just sew it on one end, bypass the blood through the new artery, and get it flowing out the other end. Do you know where they get the artery from, the clean artery to use? You probably do, if you know anyone who's had this surgery. The most common place to harvest the artery from is the leg. They'll actually go in surgically, remove an artery from the leg, check it to make sure that it's not plugged with plaque. They'll cut the desired size, and then they will bypass the heart. Sometimes they take it from the arm, sometimes they take it from the chest, but the most common is from the leg. And then you've probably heard if someone has had a single bypass, a double bypass, a triple bypass. That just is indicating the number of arteries that had to be bypassed. Now, none of these procedures is very pleasant. They're very expensive. Angioplasty can be $5,000 to $8,000. Stents can be $2,000 a piece, plus $3,000 to put them in. The average cost of a cabbage a few years ago was $44,000. So it's very expensive to treat this thing that is the leading cause of death in the United States. The problem with the angioplasty, stent, and cabbage is that none of them are permanent solutions. Especially with the bypass graft, many arteries can reclog in 5 to 10 years. So it's not like a permanent solution, like getting your appendix out and now it will never be a problem again. It's a temporary fix. All three of them are very expensive temporary fixes. One of the things that students often ask when we talk about this is there any way to just go in and vacuum out the fat and just get rid of it? And I've talked to a cardiac surgeon before, and I was told that there is a tool that they sort of call a rotozip. I think it has a fancier name than that. And it's a spinning blade. But the reason that they don't use it regularly is because it's risky. One is because if you went in there and were using a spinning blade in this teeny tiny artery, if you tore a hole in the side of the artery, then you've created a new medical problem that's very dangerous. The other thing is, as you're rotozipping in there and loosening the plaque, a chunk of the plaque could break off and actually travel to another part of the body and sort of act like a blood clot, because it would be this big chunk that could get caught somewhere else, which is, again, a very serious medical problem. So that's the explanation that's been given to me. If someone is given medications to lower their cholesterol, like Lipitor or something, it essentially stops the plaque development. but it doesn't generally reverse it. And we know from autopsies that the plaques can begin at age 15, and in many of us, they are already well developed by the age of 30. So, you might be thinking to yourself, there has got to be a better way. There is a better way. Dr. Dean Ornish has a program called Dr. Dean Ornish's Program for Reversing Heart Disease. And Ornish saw that this was the way we treated the leading cause of death in the United States, sort of just like an assembly line of angioplasties and stents and cabbages, and thought to himself, there has to be a better way. So his program involves essentially a vegan diet, so no animal foods except non-fat milk and yogurt, but otherwise no meat, no fish. Stress management, exercise daily, and a support group where you talk with other people about how much it sucks to have heart disease. And guess what he's able to do? He is able to do something by changing lifestyle factors in his patients that medical treatments cannot accomplish. Angioplasty, stent, and cabbage temporarily fix the problem. They don't get rid of the plaque. They don't shrink the plaque. They just keep the blood flowing for another few years or months. Ornish has been able to reverse the plaques. So, for example, one of his studies that was published, folks did the Ornish plan plus smoking cessation. So if we remember back to our list we made at the beginning of this, smoking was on there. Smoking cessation plus the Ornish plan times 1 year. And folks that had 40% occlusions at the end of the year had 37% occlusions. He compared this to a control group who did not follow his plan for a year but continued with their normal lifestyle habits. They went from 42% narrowed to 46% narrowed or occluded. So it's not huge, it's not miraculous, we're talking 2 and 3% reduction in plaque, but it's the only tool we have that reduces the plaques, that makes them go the other direction. When left alone with normal eating and exercise habits, they continue to get worse. In 1 year, in the control group, they got about 3.5% worse. And in 1 year, in the Ornish group, they got about 2.5% better. And if you compound that by year after year after year, you can see how the standard American diet contributes to heart disease. And a drastic change in lifestyle factors can actually reverse it. He's taken the same program and implemented it with men who have active prostate cancer, and he's been able to reverse prostate cancer as well. So usually people's response to this is so drastic. How could you expect anyone to do something as drastic as a vegan diet and going to support group and stress management? And by the way, the stress management is either something like guided meditation or yoga or something like that. I would argue that using a chest spreader and cracking open your chest to sew a part of your leg onto your heart is pretty drastic as well. But we do that all the time and we think it's no big deal. And mostly I just want you to see the power of lifestyle choices. Diet and exercise. You've heard it a million times. I know it doesn't even mean anything anymore. Diet and exercise, diet and exercise, diet and exercise. But it really matters. What you eat matters. Whether you move your body or not matters. How you manage stress matters. And how you manage your feelings and emotions matters. So if you're looking at this and you're thinking, well, there's no way I could ever do this, but I certainly don't want heart disease, could you possibly compromise? If the standard American diet, which is called the SAD diet, which I'm sure, as you know, after having been in this class for a while, is high in saturated fat, high in sodium, high in total fat, high in trans fat, low in fruits and vegetables, low in fiber, if this is causing heart disease, and Ornish, over here, with his primarily vegan diet, is reversing heart disease, and you think that Ornish is too drastic, no way I could ever do that, what if you took some steps this way? I think I said that wrong. Let me back up. I just wrote my arrow in the wrong direction, so let me fix that. If you think that Ornish is too drastic, and there's no way you could possibly be a vegan and exercise every day, but this is where you currently are, is with the SAD diet, is there any way you could move a few steps towards something like Ornish? Baby steps, 1 meatless meal a week, switching from whole milk to non-fat milk or 1% milk, adding 1 fruit serving and 1 vegetable serving a day, adding a serving of beans every day, reducing your intake of red meat, trying to exercise once a week. If this diet and this lifestyle is causing heart disease, and this diet and lifestyle is reversing heart disease, I think we know which way we need to go to not have heart disease. We need to go in this direction. So if we said Ornish was only a treatment for people who had established coronary heart disease already, and you're over here and you're thinking, well, I don't have heart disease, I'm 25, I'm young, I'm healthy, maybe you only need to go a little bit towards Ornish. Maybe you don't need to go as far because you don't have 80% occlusions that need to be reversed. But if you continue to eat the standard American diet, chances are it's not going to serve you well, and you will probably have to make dietary changes at some point in your future or choose medical management instead. So I don't mean to be negative or scare you or be doomsday about how we're all dying from heart disease, but it is the facts, it is the truth, and I want you to know that lifestyle factors make a difference in who gets sick and what they get sick with and how bad it is for most diseases, especially the lifestyle diseases like heart disease. So there you have it.